Hi, good morning. Holly, the happy cancer patient here. Just wanted to explain something. A lot of people have been asking what kind of cancer I have, and I say I have leukemia, chronic lymphocytic leukemia. And they say, what is that? What is leukemia? So I thought I would just explain briefly what is leukemia. Okay, leukemia is a blood cancer of my white blood cells. Something's gone wrong with my bone marrow and it's pumping out funky, cancerous, rogue cells. Of course, your white blood cells are what cleans your blood. It engulfs germs and things so that we stay nice and well and healthy. Disable the white blood cells, which is about 60% of your immune system. Oh, you're in a world of hurt, which is where I am. How do you fix it? It's everywhere. It's not like a tumor where you can point to it and go, oh, there it is right there. You can cut it out surgically and try and treat it. It's everywhere. It's in my blood, and everything that's connected to my blood is connected to the cancer, which means every cell in my body is connected to the cancer and it floats everywhere. And that's why it's so hard to get rid of. That's why it's classified by conventional doctors as incurable, because they say there is no way to cure it because there's no way to fix bone marrow. We don't know how to fix bone marrow, of course, until now. So a normal healthy person would have about 5,000, each one of these little white blood cells represents about 1,000 white blood cells. So you got about 5,000 white blood cells in a microliter of blood, in a drop of blood. You'd have about 5,000. This is how many I have. 172,000. 34 times more white blood cells than I'm supposed to have. And these are nice, good, white, clean, healthy blood cells that do their jobs. These are speckled and spotted and brown and discolored. They're rogue cells. There's a few in there that are still good, but they're rogue cells. They're not doing their jobs anymore. And they're growing. They're growing exponentially. They're growing and they're growing and they're growing and they're doubling like every 3 months, every 2 to 3 months, they're doubling more and more. And it's piling up in my system. That's why my lymph nodes are just completely swollen. My spleen, which I think is supposed to be about the size of my fist, is currently the size of a kid's Nerf football. It's trying to get these cells out of my body, but it's completely and totally overwhelmed by the whole system. And you only have so much room in your abdominal cavity. The Lord made just enough room for our organs and nothing left over. So if something's 2.5 or 3 times bigger than it's supposed to be, it crowds out everything else and it's crushing my other organs. That's why doctors say, the 3 oncologists I talked to said, it's incurable. We can't do anything. There's nothing we can do for you. It is terminal and it will take your life. Until now, I found a doctor, the one that I'm here in Reno. I'm going to start treatment today. How do you fix this? Well, tune in next time and I will explain how we're going to fix this and how the treatment that I'm going to get today, I'm starting my chemotherapy to fix this problem. How do you get rid of the cells, but how do you repair the bone marrow so that it won't just grow right back? This doctor knows how to do that. So please be praying that phase 1 is going to be kill off all of these cells, which I start today, bring it down to a nice normal level where my spleen goes back to normal. So thank you for all your prayers. Please keep praying and tune in next time. This concludes your audio-visual demonstration for today.